Hi, Patrick. Previous discussion, we discussed the benefits of SGLT2 inhibitors for people living with chronic kidney disease, both with and without type 2 diabetes. But what about the GLP1 receptor agonist class of drug? Of course, some very beneficial effects for our patients living with type 2 diabetes. But what is the impact of the GLP1 receptor agonist class on chronic kidney disease progression?
Well, I think a good place to start probably is actually the draft KDIGO ADA document that should be published very soon, actually, in its final form. And they remind us actually that one of the bases, if you remember, of that pyramid, the base that is lifestyle, and one of those, the new lifestyle target based actually on the look ahead data, is weight loss. And of course, GLP-1 receptor agonists are really good at that. And then but further up the pyramid, of course, first line agents were metformin for glucose lowering alongside SGLT2 inhibitors for glucose lowering, and obviously the renal benefits we've already talked about. But then for when there was further glucose lowering benefits as a goal-directed therapy, the next agent they recommend is a GLP-1 receptor agonist. So that for me makes a lot of sense, because of course these agents are really good glucose lowering treatments, and we can use them right down to an eGFR 15, certainly some of them. And so that's great. And of course we need to manage those glucose for protection, for the broader microvascular benefits. And then let's not forget the cardiovascular benefits. They're clearly there for several of these GLP-1 receptor agonists. So I think, and that's obviously, more people die of cardiovascular disease than renal disease, sadly, if you've got chronic kidney disease. So that's super important. So I think that's that's where they sit there. So, but I suppose just one of the bits behind this, there are an audience of nephrologists and other physicians interested in renal disease. So what about renal specific outcomes? How does it look like in the class there?
Thanks, Patrick. Yeah, well, of course, with SGLT2 inhibitors, we had a number of dedicated SGLT2 inhibitor renal outcome studies, didn't we? Credence, DAPA-CKD, and then more recently, EMPA Kidney, which all showed compelling evidence for the class. But so far, we have yet to have published a dedicated renal outcomes trial for a GLP-1 receptor agonist. So what we have, though, are secondary outcomes from some of the cardiovascular safety trials for GLP-1 receptor agonists. And one of note was the Amplitude-O trial. So the Amplitude-O trial actually explored the impact of a currently investigational once-weekly GLP-1 receptor agonist called epeglenetide. And what was interesting about the Amplitude-O trial was it actually recruited more individuals with renal disease than the other GLP-1 receptor cardiovascular outcome trials. Around 1/3 of people in Amplitude-O had an eGFR of less than 60 mils per minute. And also of note, there was significant SGLT2 inhibitor use at baseline in Amplitude-O. Around 15% of participants in Amplitude-O were on an SGLT2 inhibitor. And individuals were followed up for a relatively short period of 1.8 years in Amplitude-O. So what did they find? Well, in terms of the primary endpoint, there was a statistically significant 27% relative risk reduction in the primary outcome of MACE, major adverse cardiovascular events, consistent with the rest of the class, or some of the other class. But what also was very interesting was epeglenetide was also associated with a significant 32% relative risk reduction in a pre-specified secondary composite renal outcome of worsening renal function or macroalbuminuria. So this is the first time we've seen really such a robust renal outcome with a GLP-1 receptor agonist. And notably, these benefits, these renal benefits of epeglenetide were seen independently of baseline SGLT2 inhibitor use, independently of baseline metformin use, and independently of baseline eGFR as well. So this to me suggests that when using GLP-1 receptor agonists and SGLT2s in combination, the cardiovascular and now perhaps the renal benefits may well be additive. What are your thoughts on that, Patrick?
I think I would agree with you. It's the most compelling data we've got thus far. But let's not forget some of the data which fell out of the Rewind study. Rewind used once weekly gelaglutide, 1.5 milligrams, which of course is actually commercially available to our patients. So perhaps this is something which could be used now. And it was a cardiovascular outcome study, as was Amplitude O, but they did have a exploratory renal outcome, and it was again a composite outcome, slightly different perhaps from the more conventional outcomes, because one of the eGFR drop was actually only 30%. So ultimately the renal exploratory outcome was not as impressive, let's face it, as we've seen with eptiglutide. But in the sensitivity analysis, when they looked at all of this, the primary outcome was driven primarily by that people progressing on to macroalbuminuria. But if you took a more conventional renal outcome, which would focus on a 40% or a 50% drop in eGFR, then actually that would have been a positive outcome there. So perhaps it's not a huge surprise what we've seen in Amplitude O. So that, we've got some data there. But I suppose, what about renal specific or renal outcome trials? I mean, are we getting any of those in with GLP-1 receptor agonists, Kevin?
Yeah, good question, Patrick. So whilst we said we have no published dedicated renal outcome study for GLP-1, we do have one, and to my knowledge, the only one currently recruiting, called the FLOW study, looking at once weekly injectable semaglutide and its impact on the progression of chronic kidney disease. 5-year study, still recruiting. So we're not going to get some results for a while yet, but it is recruiting participants all the way down to an eGFR of 29 and significant levels of albumin in the urine. So it's a sort of primary endpoint of this study. It's a composite primary renal outcome, a 50% drop in eGFR or greater, reaching end-stage renal disease, death from kidney disease, or death from cardiovascular disease. So watch this space. It'll be really interesting to see what this study shows, and hopefully will provide us the highest quality and most robust data to answer that question: do GLP-1 receptor agonists reduce the progression from chronic kidney disease?
Yeah, so I suppose to sum it all up, really, there is some evidence, but the evidence certainly is not in the same magnitude that we get with SGLT2 inhibitors. But it's really important to think of those broader metabolic effects that we get with GLP-1 receptor agonists, and maybe so it would be a good add-on treatment in a sense to when we need those metabolic benefits. But if we're looking for specific renal outcomes and that combination, maybe that's not quite for today. That's for tomorrow. Would you agree?
Absolutely. Exciting times ahead in the world of cardiovascular, renal, metabolic medicine, and plenty more data to discuss in the future.
Okay.
Thanks, Patrick.
Cheers. Thanks, Kev.